If you're losing hair on Ozempic or Mounjaro, don't panic. I'm a nurse, and I'm about to tell you exactly why it's happening and exactly how to stop it. Stay with me, because the most important part is this. For most people, this is temporary. First, I want to say this gently. I know how scary it is to see more hair in your brush, in the shower drain, on your pillow. You're doing something good for your health. You're finally seeing the scale move. And then this. It can feel like a cruel trade-off. You are not imagining it, and you are not doing anything wrong. I'm a registered nurse, and I've spent years helping patients through exactly these kinds of changes. Hair loss on GLP-1 medications like Ozempic, Wegovy, Mounjaro, and Zepbound is real. It's common enough that it showed up in the clinical trials. And here's the good news. It almost always follows a predictable pattern that we understand well. So today, I'm going to walk you through 3 things: the actual science of why this happens, what's getting depleted inside your body, and my step-by-step recovery protocol. The same kind of advice I'd give a patient sitting across from me. Let's get into it. Let's start with the name, because once you understand it, it stops being scary. What you're experiencing has a name: telogen effluvium. Say it with me: telogen effluvium. It's a mouthful, but the idea is simple. Your hair is always in cycles. At any moment, most of your hairs, about 85 to 90%, are in the growing phase. A smaller number are in the resting phase, getting ready to fall out so a new hair can grow in. That shedding is normal. We naturally lose around 50 to 100 hairs a day. But when your body goes through a big shock, and rapid weight loss is a shock, even a healthy one, it hits a kind of emergency switch. A large batch of hairs that should have stayed in the growing phase get pushed early into the resting phase, all at once. Then, about 2 to 3 months later, they all shed together. That's why the hair loss feels so sudden and so dramatic. It's a delayed reaction to something that happened weeks ago. Here's the part I really want you to hear. Telogen effluvium does not kill your hair follicles. The follicles are alive, they're just resting, which means the hair can, and does, grow back. This is shedding, not permanent loss. So why does this happen so often on GLP-1 medications specifically? It comes down to how well these drugs do their job. Ozempic, Wegovy, Mounjaro, and Zepbound work by quieting your appetite. That's the point, and it works beautifully. But here's the side effect of that success. When you're barely hungry, you tend to eat much less, and you often lose weight fast. And rapid weight loss, combined with eating very little, creates a perfect storm for 3 things. 1, a caloric deficit big enough that your body decides hair growth is a luxury it can pause. 2, not enough protein, because most people on these meds are eating smaller portions, and protein is the first thing that falls off the plate. 3, micronutrient gaps. When you eat less food overall, you also take in less iron, less zinc, fewer of the vitamins your follicles depend on. Notice what's not on that list: the medication itself attacking your hair. In the studies, hair loss tracked closely with how much and how fast people lost weight, not with some toxic effect of the drug. That's actually great news, because it means the problem is mostly about nutrition and pace, and those are things we can fix. Let's get specific about what your follicles are starving for, because this is where you take back control. Protein is number 1. Your hair is literally made of a protein called keratin. If you're not eating enough protein, your body rations it for the organs that keep you alive, and your hair drops to the bottom of the priority list. Iron is huge, especially for women. Low iron stores, what we measure on a lab as ferritin, is one of the most common hidden drivers of hair shedding. You can have normal blood counts and still have iron stores too low for healthy hair. Zinc plays a direct role in building and repairing hair tissue. When intake drops, hair can suffer. And biotin, a B vitamin, supports keratin production. True biotin deficiency is genuinely rare, but eating very little for months can nudge anyone toward the low end. The theme here is simple. Your hair is the first thing your body sacrifices when food is scarce, and the last thing it rebuilds when food returns. So our whole strategy is to feed it back. Okay, here's my protocol. This is the heart of the video, so grab a pen. Step 1, hit your protein target every single day. This is non-negotiable, and it's the most powerful thing on this list. Aim for a minimum of 60 grams of protein a day, and honestly, for most adults losing weight, 80 to 100 grams is even better. Front-loaded. Get protein into your very first meal, so you're not playing catch-up at night when your appetite is gone. Think eggs, Greek yogurt, chicken, fish, tofu, a protein shake. If your appetite is tiny, a shake is your best friend. It's protein you can drink when you can't face a plate. Step 2. Cover your nutritional bases. A simple daily multivitamin fills small gaps. Then we add a few targeted supports, and I'll give you the exact, safe dosages in the next section. Step 3. Take care of the scalp itself. Be gentle. Don't scrub aggressively. Don't yank a brush through wet hair. Ease up on tight ponytails and high heat for a while. A soft scalp massage for a couple of minutes a day boosts blood flow to those resting follicles. It's free, it feels good, and it can't hurt. Step 4. Slow down if you can. If your weight is dropping very fast and the shedding is severe, talk to your provider about your dose and your pace. Sometimes easing the speed of weight loss is the single best thing for your hair. Now let's talk supplements. What's worth your money and what isn't? I'll start with the ones that earn their place. Collagen peptides. This is basically extra protein aimed at your skin, nails, and hair. Easy win. Stir 10 to 20 grams into your coffee or shake. It's a gentle, low-risk way to push your protein higher when your appetite is low. Biotin. With honesty. If you're truly low, biotin helps. If you're not deficient, taking megadoses won't grow you a magical new head of hair. Your body just pees out the excess. A reasonable dose is around 2,500 to 5,000 micrograms. But here's a critical nurse warning most influencers skip. High-dose biotin can throw off blood tests, including thyroid tests and the troponin test used to diagnose heart attacks. So tell every provider you take it and pause it before blood work. Zinc, if you're low. A typical supportive dose is modest, and please don't exceed about 40 milligrams a day total, because too much zinc actually blocks your body from absorbing copper. Iron, and read my lips on this one, only if a blood test shows you're deficient. Iron is the most effective fix when you need it, and genuinely risky when you don't. Too much iron is toxic and builds up in your body, so we do not guess with iron. You get your ferritin checked, and your provider tells you yes or no. And now the stuff I tell you to save your money on. Skip the expensive hair growth gummies that are really just sugar plus a giant dose of biotin in a pretty bottle. More biotin past a certain point does nothing extra. You can't out-supplement a protein and iron gap with B vitamins. Skip keratin pills. You can't eat keratin and have it travel to your scalp. Your stomach just digests it into amino acids like any other protein. Eat the protein directly. It's cheaper and it works. And be skeptical of any proprietary hair blend that hides its doses, any detox for hair, and any product promising results in 2 weeks. There is no 2-week fix for telogen effluvium, and anyone who promises one is selling you hope, not biology. Save that money. Put it toward real protein and the blood work that tells you what you actually need. Now, most of what we've talked about is the normal, temporary shedding pattern. But I'm a nurse, so I'm going to make sure you know the red flags that mean it's time to be seen, not just supplemented. Call your provider if you notice patchy or circular bald spots rather than even all-over thinning. That can point to a different condition entirely. If the heavy shedding is still going strong past 6 months, that's worth investigating. If your scalp is itchy, painful, red, scaly, or scarring, or if your hair loss comes with other symptoms like deep fatigue, feeling cold all the time, weight changes that don't fit, or changes in your nails, because that combination can signal a thyroid issue or a deficiency that needs a real workup. Asking for that ferritin, thyroid, and zinc panel is not being dramatic. It's being smart. A simple blood test can turn guessing into a plan. So when will you see your hair come back? Let me set honest expectations, because patience is part of the medicine here. Once you fix the underlying cause, once your protein and nutrients are back on track, the shedding itself usually starts to calm down within about 3 months. Then, regrowth. You'll often spot it first as little soft baby hairs along your hairline and part, those short flyaways that won't lay flat. I know they're annoying. Celebrate them anyway. They are proof your follicles woke up. From there, full recovery typically takes somewhere between 6 months and a year. Hair grows slowly, only about ½ an inch a month, so this is a marathon, not a sprint. But the destination is real. Telogen effluvium very, very rarely causes permanent baldness. You are going to get your hair back. To make this easy, I built a hair recovery checklist you can print and stick on your fridge. Your daily protein target, the supplement doses, the exact labs to ask your doctor for, and the red flag list, all on one page. The link is right below in the description. And if a nurse breaking this down without the fear-mongering is what you've been looking for, subscribe and turn on the bell. I make videos like this for you, the person actually living the GLP-1 journey every week. Before you go, hear me one more time. For the vast majority of people, this hair loss is temporary. You are not losing your hair forever. Your body is just catching up to how fast you've changed. Feed it, be patient with it, and it will come back. You're taking care of your health. Now let's take care of your hair too. I'll see you in the next one. If you're